Oh, hello. It's always good to have you join us on our show. Yesterday, we focused on the environment with emphasis on climate change. Today, we're shifting gears a bit as we'll be focusing on the health sector. The big question on everyone's lip is, are we experiencing a third wave as far as COVID-19 pandemic is concerned? Our focal point on today's show is on COVID-19, the Delta variant, and matters arising. And like we said in our opening, are Nigerians aware that there's a Delta variant? And what exactly is the Nigerian situation? Our first report, a backgrounder put together by Francis Ogbe, will tell us more.
Nigeria is already experiencing the third wave of COVID-19 pandemic as cases of Delta variant are increasing in several states.
You have the Alpha variant, you have the Beta variant, you have Delta variant as it is. So there are various variants. However, it is discovered that the Delta variant seems to be one of the variants that is rapidly, or there's high rate of infection caused by the Delta variant, and the symptoms also seem to be a bit more severe compared to the others. As of on 20th of August, the number published by the NCDC shows that about 1,000 plus cases were diagnosed just that particular time. So why this surge is that there are many factors to it. One, we have international travel, which opens door for many people to be infected. Now, ignorance also play another role in that many people felt that, oh, this thing is not real, because the way it was projected that Africa or Nigeria, many people were going to die from it. It didn't come out to be so, based on the knowledge that we have of this virus.
We are not out of the woods yet, so the need for all to ensure strict compliance with COVID-19 safety protocols following the spread of Delta variant of the virus cannot be overstated.
In 2020, when the whole thing came up, a lot of people were willing to wash their hands. There was hand sanitizer being used, face masks being used everywhere. But currently, if you check very well, most people don't use hand sanitizer. Most people enter premises without washing their hands. A large number of people not even using face masks. And if you're even wearing face masks in a car or in a public transport, so everybody look at you as if you're looking strange to them. So as long as these basic rules of social distancing, hand washing, sanitizing of hand, use of face masks are not being obeyed, definitely infection rate will increase.
There is a clarion call for all to get vaccinated, as vaccination prevents severe cases and reduces hospitalization and death, but does not eliminate contacting the virus. Hence, the need to religiously observe the non-pharmaceutical protocols.
Vaccine protect, just the way we have immunization. Those vaccines we give to our children from birth down to first 2 years of life. This is the same thing that this COVID-19 vaccine is meant to do. It's just a way of developing immunity to prevent an individual from coming down with the disease, or at least from being infected. And if it happened that the individual get infected, at least the severity of the illness will not be that much.
The fight against the COVID-19 pandemic cannot be left to the federal government alone. States are expected to ensure sample collection and testing for COVID-19 is accessible to the public.
On a daily basis, we only get the result of the total number of those that are positive. Now, if we have idea about the total number of tests carried out before we now have social number being positive, it will now give us an idea that, okay, we are either testing enough or we are not doing enough. Then you may discover that some states may not have been recording anything for the past few weeks. So it's either that tests are not being carried out or they're actually testing but 0 cases. So there's no way we can conclusively say that, okay, we are doing enough or we are not, until we're able to know the total number of tests carried out.
The recommended control measures to limit the spread of the Delta variant continue to be testing, following the existing public health guidance and abiding by the current travel and public restrictions.
Let's do the basic things, the preventive measures. Wear face masks, wash our hands regularly with soap under running water, sanitize your hand in the absence of that, then maintain social distancing, in other words, 2 meters apart. So avoid any gathering that lead to overcrowding and includes setting, and then go to any place with testing facility. Once you have any symptom, get tested, and then early detection, early management will prevent severe disease. And once an individual is tested, he or she can also go for the vaccine and take the doses of vaccine. I've taken mine and I'm doing first and second dose already.
We can deal today beams a satellite on COVID-19 pandemic, the Delta variant.
Actually, like the respondent, he said he has taken his vaccines, and the question is, have you taken yours? Right from the first wave, Lagos State has been a flashpoint, and honestly, they have actually put on the good fight, and they've been fighting it. Now, there's a Delta variant. Are they aware of this variant? And what are citizens there doing to protect themselves, to keep to the protocol? NTA Channel 10 Lagos has put together this feature. Let's watch it.
According to medical experts, viruses evolve over time, becoming stronger and more resistant to cure. This is regarded as a survival strategy. The Delta variant, one of the variants of concern since the COVID-19 pandemic began in 2019, is no exception.
The Delta virus is the prevailing virus at the moment. It's a very effectively transmitted virus. It goes from person to person faster than the original virus. It makes people sicker than the original virus. So we now have what we're describing as the Delta variant that appears to be more dangerous than the original type.
The Alpha, the Beta, and the Delta are variants of concerns because of their increased transmission rate.
It is indeed a variant of great concern, but how informed are Lagosians about this variant? How well are the COVID-19 health protocols observed today?
I don't really know much about the Delta variant. All I know, as they said, is that it's people get it faster than the normal COVID-19, the original COVID-19.
Why you don't wear those masks first?
They say COVID-19 has finished.
Who tell you say not finished?
I see many people who no wear. So I think it's not.
Most people don't give each other space again. They're already moving together because they believe it has gone.
This is the NIMA testing center here in Yaba, Lagos. At the time at this testing center, we were having close to 200 people in a day. And we take their samples, we run it, and we send them results. But sometime about 3-4 months ago, the numbers dropped down. We were struggling to even get 20 people to come for tests. But recently, just about 2 months ago, maybe because of the Delta variant, people are trooping in now. So now we are back to the 150, 200 per day. And what we notice is that most of them, over 50%, most days, they tested positive.
There are people that are trying to overcome our restrictions to movement. They're trying to maybe come in with fake tests. They're trying to avoid isolation. They're not going for their day 2 or their day 7 tests. So that's how the virus is sneaking into Lagos. Right now in the third wave, we're seeing increasing numbers of cases in Lagos every day. Our isolation centers are filling up. We're managing mild cases at home, and we're admitting severe cases that need closer medical supervision. We have space, and we have contingency plans. We have enough oxygen. We've built 2 plants. We're about to build a 3rd plant. And we also have our partners who are supplying us with oxygen. So far, we're coping with the oxygen demand.
Information is key, and as it is often said, prevention is better and less expensive than cure.
Studies are still going on with respect to the Delta variant. However, vaccination is still what is recommended. It is still safer to be vaccinated.
We're not saying that the vaccine will stop you from getting the infection. We're just saying the vaccine will stop you from getting very sick and dying, even though it doesn't stop you from contracting it in the first place. But the evidence around the world now is that the more you vaccinate, the less severe the infection will be in your population. So Lagos State now is trying to accelerate its vaccination strategy.
Therefore, let us all follow the precautionary health protocols until COVID-19 becomes a thing of the past.
Thank you very much. That report was put together by Julie Musindi of ETV Lagos. Thank you, Julie. Okay, from Lagos, ETV will be going over to Sokoto. What is the situation in Sokoto? Are the residents there taking the necessary precautions? Are they getting tested? Are they getting vaccinated? NTA Sokoto Network Center will tell us more.
It's another round as this disease control team works to figure out if there are cases of COVID-19 Delta variant infection from dozens of samples here.
Even today, we received 260 samples from the state. And that's how we have been receiving samples. And they are all turning negative. But we never relent. We keep processing samples.
It takes a meticulous team like this one to figure out possible cases of COVID-19 infection or the emerged Delta variant of the virus. The team walks samples on a daily basis to ensure that one positive case is captured and tackled before it goes viral.
Doctors working specifically on isolation center were actually exempted from joining the strike. They are not part of the present strike. They are working, we are seeing patients, and we are doing tests, and in case if any patient happen to be positive, will be admitted and treated.
Weekend Deal team was privileged to have a glimpse into the samples and cases captured in the last 1 year by the Disease Detection and Control Unit of the Usman Danfodio University Teaching Hospital. It reveals to us that ours in the last 1 year was a minimal share of the pandemic that has globally ravaged lives.
If we have gone from NTA, you may see where we have so many cases. We have sometimes last year we have up to 80 to 90% positivity rate, even though most of them are asymptomatic. Unlike now, whereby we are still testing and we are not getting positive rate, meaning the disease is either people have had immunity, diseases are not longer infecting them, or we don't have a virus that is spreading in the community.
Are people even aware how lethal this disease is and what has changed about the virus in the wake of the pandemic third wave? Dr. Sabit is leading in the Danfodio University Teaching Hospital Committee for Disease Detection and Control. He shares his assessment on adherence by people to safety protocol guide in the state.
Before initially we have issue related to if somebody is going to be tested for COVID-19. It will be a tug of war before somebody agreed to go for testing. But unlike now, somebody will voluntarily come and try to tell you that, please, why can't you test me? Because honestly, this catarrh that is holding me refused to go. I say, okay, no problem. Okay, test you to see whether it's COVID-19. If it is not, it's just an ordinary catarrh.
What's the state of things in the fight against COVID-19 infection, detection and control?
I am a member of Sokoto State Task Force of COVID-19, and I have been attending meeting, and they are still sending me invitation for the meeting. So initially, we are holding meeting on daily basis, for a year, until when the second wave was almost zero. We are no longer having cases. So the meeting has been rescheduled to be taken. Instead of daily, it's twice a week. And that meeting is still held Monday and Thursday.
As experts in governments all over the world make relentless efforts to end the pandemic, whether the virus and the variant is eventually contained depends largely on our caution and cooperation.
Welcome back. COVID-19 is real and this new variant is here. We must be careful. I mean, we're told that the new Delta variant is more aggressive. To contact it is more aggressive, and the disease progresses even more aggressively. And so we must keep to the protocols. Let's go over to Ogun State to see the state of COVID-19.
The recent resurgence of the Delta variant of COVID-19 in Nigeria poses another great challenge in the health sector. It is rather worrisome to note that when the government the world over is having a relief over the containment of the dreaded COVID-19, especially with the availability of COVID-19 vaccine of different types, then broke the news about the third wave called the Delta variant. Worthy of note is the fact that many Nigerians are still living in denial and losing the guards on the dangers of COVID infection. In Ogun State, for instance, efforts to get accurate information from government proved abortive. Meanwhile, feelers around the town reveal that some people, though are aware of the existence of the Delta variant of the COVID-19, they are no longer adhering to the safety protocols. Worse still, many believe and act as if the COVID issue is just a myth, going about business as usual.
They only tell us in mouth to observe it, but most of them are not observing. So as a matter of fact, we look up onto them, we see them. So as you can see around, a lot of people doesn't, including myself.
Not all the time that I touch my hand, not all the time, but especially that fake mask, it doesn't master me. It's like a problem to me. And when I wear it, I didn't feel comfortable.
You have to be very careful, use just that I just have to remove my mask now to talk to you. So, distancing and all those. But at the same time, someone needs to be careful, Even this exchange of money and everything, those people can contact through that means. But the use of sanitizer is very good, and being hygienic in anything you do, that will really help. But I think the awareness should be done more. People are always relaxing, and people's immunity also vary. Somebody can even have it and it won't show, and the person can find a way of transmitting it to another person, and that person will now be showing those symptoms. But to be on a safer side, we just need to observe all those things necessary: wash our hands, use sanitizer, then we use the nose mask.
As the third wave of the pandemic, talking COVID-19 Delta variant, is still on, it is important that residents should adhere strictly to the safety rules given by the government so as to halt the spread of the dreaded COVID-19.
Okay, so with the when there was a steady decline in the number of infected cases, confirmed cases, a lot of our isolation centers were shut down, and people were thanking God. But all of a sudden, we've woken up to the reality that the numbers are going up again, and there's need for our isolation centers to be up and ready. And then people really getting vaccinated? Well, to tell us more, Magdalene Haikomo has put together this report. Let's watch it and see.
With the latest occurrence of the third wave of COVID-19 and the Delta variant, the World Health Organization (WHO) disclosed that the Delta variant, which is spread worldwide, the most transmissible variant since the COVID-19 virus began its spread in 2019. As a result of this recent development, experts are cautioning against adopting a relaxed attitude, which is capable of increasing the spread and compromising citizen safety globally. The Federal Capital Territory, Abuja, is a fast-growing city with a huge population, with a number of visitors in and out of the city, either by air or land on a daily basis. Experts have cautioned that continuous awareness and enlightenment about COVID-19 and the Delta variant should be encouraged.
The Delta variant is one of the many variants of the COVID virus, right? And it is one of the mutants that have occurred over time. With viruses, over time they mutate. Delta variant is one of the most dangerous variants of the COVID virus because it is transmitted over 50 times faster. All right, it is more infectious, it is more virulent, it kills faster, the symptoms progress rapidly. All right, so from onset to the severity of the disease is very short. And within a very short time, you find people having difficulty in breathing and requiring oxygen and even more advanced treatment. So it's very important that we know that the Delta variant is in Nigeria, in many states of the country, including the FCT, and that is the more reason why we must take preventive measures more seriously.
The Presidential Steering Committee on COVID-19 urged Nigerians to ensure strict compliance to the safety protocols following the spread of the Delta variant across some states, and also directed all COVID isolation centers in all states to be activated.
Nothing is off the table when it comes to protecting the lives of the people of this country. We would not hesitate in taking measures that will be considered quite stringent. All the countries of the world are applying different measures. Countries that were adjudged to have successfully dealt with COVID-19 suddenly realized that they had to impose some certain measures to ensure that they continue to balance lives and livelihood.
Here in the FCT, we have not shut down our isolation and treatment centers. Even when the pandemic was a little bit low, we decided to keep them open because we knew that there may be an upsurge. So right now we have equipped all our isolation centers. If you go to this day dome, it's well equipped. We have our staff who are positioned there. We also have oxygen ready in case we have some patients that will require that.
The feeling on the street is that the pandemic has taken a flight from Nigeria. Hence, people have reverted to old habits of doing things. The truth is the coronavirus pandemic is very much with us. Every Nigerian must observe the safety protocols and get vaccinated. COVID is not a ruse. COVID is real. Stay safe.
Vaccine is safe and it has been certified safe and usable.
Okay, that report was actually by Magdalene, is actually on compliance of the residents of Abuja as far as the COVID-19 protocols is concerned. Thank you, Magdalene. The next one is from NTA Abuja, and it is on now on the isolation centers and vaccine rollout, and it's put together by Ori.
In recent times, there has been a significant reduction in the number of daily infections across the country, which has increased the number of patients being discharged across isolation facilities, leading to the shutting down of isolation centers in many states across the country, including the FCT. The Cairo Isolation Center is under lock and key. The same scenario can be seen at the isolation center in Asokoro, leaving the ones in Idu and this day dome functional in case of an emergency. As Nigerians snub these medical facilities amid vaccination and sudden invasion of the Delta strain, what effect is this having on the country's fight against the coronavirus?
The isolation centers were actually closed down because of the
reduction in the number of those that have been infected, and those that were in critical condition were not really that much because of the introduction of home-based care, as well as the issue of the vaccine that came. So the infection rate was actually very was reduced. So having to still leave it open with manpower or human resource for health, the all cadre of workers being there, and no new employment was done, and so the general other facilities will be short-staffed and all of that. So it was actually the best idea to actually prune down the number of staffs there, and some were actually closed down. So about facilities like the isolation center in Gwakwalada was still functioning. Now that the Delta variant has come and it seems to be more severe, we'll not really be getting those increased cases of severity. But I think all plans are in place with respect to human resource for health to actually take care of that when the need arises. I actually also saw the documentary that was done on isolation center across other states. The whole places were shown were in a state of dilapidation and all of those stuff. But then, you know, one thing we need to understand about this stuff is that not many of them, even those in position of authority, understand fully that COVID is here. And because of that, many also are playing politics with it. You know, initially when the issue of funds, pooling of funds, donation from well-meaning Nigerians to support all of the federal government at least gave us some funds to support a state like Lagos State. The one I actually knew of was Lagos State. I'm not sure if every other state was giving such financial support.
The recent strike by 40% of the country's medical workforce due to the unpaid salaries and poor benefit comes amid a fresh wave of a highly contagious version of the virus, severely straining Nigeria's healthcare system, which is raising a lot of concern.
The resident doctors actually form about 80% of the medical workforce, and many of these isolation centers are manned by resident doctors. Now, resident doctors are on strike. Of course, you know, the workforce will be depleted, and the workforce is depleted, and those are going to be there, maybe the consultant or the contract staff they might have to employ and all of that, will definitely be overworked. For the issue of those isolation centers, I think the state governors need to take the bull by the horn and bring back those isolation centers. They are not saying now that, okay, make them fully functional, but functionality will depend on the severity of cases or the infection rate leading to the severity of cases that are being transferred to such facilities.
Abuja being a major travel hub with a large amount of people moving in and out of the Federal Capital Territory via international travels has put anxiety and fear in the minds of residents.
Each country have their own protocols. My own worry is that in Nigeria, you know, we just have a way of cutting corners. There are a whole lot of people who will come into this country or who is going out with all sort of fake COVID-19 results. And if people also see this as a national duty, especially those that are saddled with the responsibility of checking this issue of leaving the country and coming into the country, that it shouldn't be business as usual.
The most important thing you can do to protect yourself from the Delta variant is to get fully vaccinated and also follow the NCDC guidelines.
Recently, Nigerians heaved a sigh of relief following the steady decline in the number of confirmed COVID-19 cases. But just as we're about to shout uhuru, we're confronted with another rude shock. There's a mutation in the variant, and that is called the Delta variant. Well, a lot of experts say that that could be the beginning of the third wave. To shed more light on this and more, we have as our guest in the studio the Executive Director and CEO of the National Primary Health Development Agency, Dr. Fasil Shuaib, in the house. Sir, you're welcome to the Weekend Deal studio.
Thank you for having me.
Okay. So there seem to be these cases of this Delta variant and found in states. Does it mean that we let down our guards and that's why this happened?
Absolutely not. I think what we're seeing is a phenomenon that we have seen replicated all over the world, right? The Delta variant is the result of a mutation of the commonly known alpha variant of the coronavirus or COVID-19 virus, as it were. And you can see how it caused a lot of havoc in India. I mean, without a shadow of doubt, because the world is now a global village, it's easy for people to move from one point of the globe to another, and this is why the virus made its way into the country. There's no way you can stop people from traveling, right? And what we are trying to do at the Presidential Steering Committee is to make sure that we not only reduce the number of people that are coming to the country that are potentially infected, but also ensuring that people are protected from the virus, even when it is in Nigeria. So it's not really a question of dropping the ball. It is really a question of an inevitability. It is now for us to mitigate against that inevitability.
Okay, but Nigerians seem out there in the streets, Nigerians are saying corona is over. That's the word they normally would you say. They say there's no more corona. And we also noticed some, I think, pandemic fatigue on the side of the health workers. What is your take on this, sir?
I think the concept of corona fatigue is probably not with just health workers, but everybody that has been working so hard. Nigerians have really braced up, since last year that we had the onslaught of the COVID-19 pandemic, and people have worked tirelessly. Health workers in particular have been in the front lines, making sure that people are treated, making sure that they convey the correct information about how they can protect themselves from COVID-19. So yes, you could say health workers bore the major brunt of the pandemic, but everybody, felt in one way or the other the impact of COVID-19, and this is why people are now beginning to feel like, okay, here's the time to breathe a sigh of relief. But the truth is that because the pandemic is not over, it is until it is truly over.
Yes,
we have to continue wearing face masks, doing hand hygiene, and also social distancing.
But how do we get people out there? Because it's amazing how people don't even believe you when you tell them you're here without your mask, and they laugh and say, how do we get people to come back to where we were?
It's really the reason for this is really because there's that low perception of risk. There are a lot of people who feel like they are supermen, or COVID-19 affects other people, and then unless and until somebody very close to them contracts the virus and dies, they are in that state of denial. And this is why the Presidential Steering Committee is working very hard, constantly putting out those messages that we're still here battling COVID-19, and that it is here in Nigeria, and people need to take it seriously. The thing with COVID-19 is that it's like Russian roulette, right? So it's like you could get lucky that you contract the virus and it's mild, but for some people that could be the end. You don't know where you fall. So why not take the protection? Why not first and foremost observe the non-pharmaceutical measures? And then also we now have a tool, the vaccine that is available. Why not make your way to the designated health facility and take that vaccine? That vaccine is safe, it is effective, and that is a guarantee that you are protected from severe disease, hospitalization, or death, even if you contract the virus.
Okay. I was going to ask about the vaccine, but quickly, how deadly what's the difference between this Delta variant and what we had before, and how deadly is it?
One thing that we've seen all across the globe is the fact that the Delta virus is more transmissible. It is more than 60% more transmissible than the Alpha variant. It is more aggressive. What people have observed in terms of symptomology is the fact that there's more fever. People see even more of the runny nose, the sore throat, and then people are more likely to get hospitalized because of this virus. So it is more contagious, so to speak, and with a disease that is very contagious, what it means is that it spreads through society very, very quickly, and it not only attacks people who are vulnerable, but it also increases the number of people that come down with the disease.
Okay, talking about vaccination, how do we get Nigerians to get vaccinated? Is it ramp up vaccination, I would like to say, so that let's say at the motor park, you have a place where you can just walk in. What do you think? How do we get Nigerians?
Yes.
Millions of Nigerians have not been vaccinated. How do we get them to get vaccinated?
Well, this is exactly what we're doing, and it's great that President Muhammadu Buhari and Vice President Yemi Osibanjo have come out very publicly to take the vaccine, again to demonstrate that the vaccine is safe and that the vaccine is effective. That is clear direction into all Nigerians that Nigerians should get vaccinated. We started off by not having enough vaccines because of supply issues, global supply issues with the vaccines. There was the issue of developed countries hoarding the vaccines, but now we're beginning to see more vaccines come into the country, and here's a huge opportunity for Nigerians to make themselves available. We have designated primary healthcare centers. We have designated, places even in communities like the palace of the traditional leader. We've also identified marketplaces, motor parks where we'll have teams that can give these vaccinations. But most importantly is that people have to avail themselves of the opportunity, right? We're trying the best that we can to send out the right information, publish the designated site so that people can not only walk in if they want to, but we've also published the website where people can go and register and schedule their vaccinations.
Okay. I also think that for the ordinary Nigerians, for example, the market women, can we have a center like, let's say we say market, let's say the Gariki market, so that the market woman who does not want to leave her shop for hours can quickly just walk in, take a vaccination? Are you considering things like that?
Well, absolutely. That is part of our strategy. In Swuse Market, we do have teams that go there and vaccinate. And with the second phase of the vaccination, we are also doing exactly the same. And this is not just for the FCT, all across the land, working with the governors, working with traditional leaders, religious leaders, with the state teams. Right, we've been able to designate those areas that have high traffic so that people will be able to access these vaccines. And we also leave it to the states to use the context, the local context, to decide, which are the best places that people will go to. For example, people can decide to take their vaccines in the mosques, maybe after a Friday mosque, or in the churches during Sundays. So we've really mapped out those areas where people are likely to go to. But even those areas where it's difficult to reach, the hard to reach areas, the riverine areas, mountainous areas, nomadic populations, insecure areas, all of those places have been mapped thanks to the innovative approaches that we're using, such as the use of the geographic information systems. We've been able to really map different populations and make sure that we have a plan to reach those people.
Okay. So how bad is the Delta variant situation in Nigeria? What is the real situation and how bad? What are we dealing with currently?
Yes, so we're dealing with a virus that is highly transmissible, is very contagious, and you can see from the daily reports coming out of the NCDC that there is a progressive increase in the numbers of the cases, and then in places like Lagos and especially Akwa Ibom, where large numbers of the Delta variant have been isolated and sequenced, that the third wave is actually progressing. But the way we can sort of flatten that third wave is by ensuring that we observe the public health measures that have been provided, ensuring that we also get the vaccines. The federal government has procured over 40 million doses of vaccines, and this is an opportunity for people to get vaccinated over the course of the next few months. We're already seeing a fourth wave in some countries, right? So we have to make sure that we're prepared, that once we contain the third wave, that even if the fourth wave comes, it will just be a minor blip.
Okay. So what are there different symptoms of this Delta variant? What are they? I mean, for people want to know what the symptoms are. Is it different from what we know from the Alpha variant? Are they different?
So what we've seen is a more aggressive, presentation of cases that are due to the Delta variant. Of course, the symptoms are, similar. It's the same fever, it's a sore throat, runny nose, diarrhea. Those typical symptoms of coronavirus infection. But there are also data that shows that with the Delta variant, you may not see as much anosmia, or those people that tend to say, oh, they cannot smell or they cannot taste. What the data is showing is that may not be as common.
Oh, okay.
Yes, but clearly
okay.
we are seeing a more aggressive virus because it is now fitter than the alpha variant. The whole reason behind mutation is that the virus is trying to get fitter, is getting more aggressive.
But why? I mean, as a doctor, I just want to know.
Right, the very nature of mutation of viruses is that it happens very quickly, so they're replicating very fast. But it replicates within a community when people are not vaccinated, right? So there is nothing hindering that replication. So the way to stop the mutation, the way to reduce the impact and the rapidity with which it occurs is for people to get vaccinated so that you are now protected against that variant. So if, for example, we already had herd immunity within the country, right, then the virus will not be able to replicate, will not be able to affect multiple people and then replicate and then begin to make those changes. Because anytime it affects somebody and it cannot cause disease, it dies off with that person. So there's no opportunity for it to replicate within the individual. So the whole idea is that we need to get vaccinated and we need to be able to reach that herd immunity, which will ensure that we're able to protect Nigerians from the virus.
Okay, so you're an expert and Nigerians are watching you. Please just tell them, the situation that COVID is real. They're watching. Talk to Nigerians and tell them the real situation. Let them know that we still have a battle ahead of us.
Yes, but I think the message to Nigerians is that COVID-19 is real. Real people are coming down with the virus. People are dying from the virus. You know, in the last couple of days, prominent Nigerians have died from the virus, right? So people should not take the chance of getting infected. People should take the opportunity of the availability of the vaccine to get protected. It is only when we have adequate numbers of Nigerians that have received the vaccine that we can now begin to say we have created herd immunity. Once we get to herd immunity, then you find a situation where we can now begin to seriously consider leaving off the face mask and then climbing back to normal life. But we're still a long way from there because we just started the vaccination program and people are still hesitant. From our part, as public health experts, we do not denigrate or are we cynical with people who have concerns about the vaccines. We know it is because they've not gotten the right information about the vaccines. And this is why we're working extra hard to make sure that people get the right information that is clear, that the vaccine is safe, the vaccine is effective. And look at all the millions of people, over 2 million people, Nigerians have already taken the vaccine. There's nowhere that 2 million Nigerians are falling down like a pack of cards. People have said, oh, if you take the vaccine, you're going to die, right? So people need to be really focused about what the issues are. There was a time people said, oh, let's not bring the vaccines. We brought the vaccines. They said, okay, make sure that NAFDAC certifies it. NAFDAC has certified it. They said, oh, they don't want AstraZeneca, it's Moderna. Well, Moderna is here now. Take the opportunity and get your shot so that you can protect yourself, you can protect your loved ones, you can protect your community, and then we can begin to rebuild our economy.
Okay, so if you, for example, if you had the first variant, the Alpha variant, can you still catch the Delta variant? Is that what you're saying?
Yes, absolutely.
Hey.
Absolutely. That is exactly why.
That's scary.
Yes, yes, it is, right? So this is why the faster and the earlier we get our vaccine program up and running, reaching more people, then that mutation will not take place, right? Already we're talking about a Lambda variant, which is a variant of concern. Yeah. So we want a situation where people get vaccinated and then they get protected. This is why sometimes you find people say, oh, they've contracted COVID-19 twice or 3 times. Sometimes it's because it is different variants that are infecting these individuals.
Okay, so but how secure are our borders? Because this thing comes from outside. You said in the beginning, you said, of course, the world is a global village, and people are moving around even more. How secure are our borders so that we don't get? You just called another variant. What's that name you called?
Lambda. They sell it Lambda variant. It's a variant of concern.
That's even scary. I don't even like the sound of that name. So how do we secure our borders so that we don't even get any other variant, so we can deal what we have and then I mean, be out of the woods.
That is precisely what the Presidential Steering Committee is doing. We've been able to identify some countries that have very high rates of infection, and then we've looked at the volume of passengers flow from those countries, and we were able to identify India, Turkey, Brazil, and South Africa, and we restricted the movement of people into the country, and then insisted that when they come, that they have to be quarantined, right? So we're looking at the data and taking decisions on how we can protect our borders, working with folks that are in the ports of entry, to make sure that people are also not sneaking through the land borders and then coming to cause an explosive infection in our country. So there is a lot of work that the NCDC is doing, the Federal Ministry of Health, and other line entities to make sure that our borders are protected.
Okay, now we are approaching the political era. Soon the Anambra elections will be knocking. What is being put in place to ensure that at the rallies or whatever they are going to do, there will be social guidelines? People had heard today's very important guidelines, and people will be vaccinated, so that with this kind of political gathering, we don't have crisis on our hands.
Yes, the Presidential Steering Committee has not withdrawn all of the guidelines that were issued several months ago. All we've been doing is just emphasizing, on a regular basis, that those guidelines are still in place around, people not, gathering and not observing the non-pharmaceutical interventions, that when people are going to gather, they have to observe social distancing, they have to wear their face masks and observe hand hygiene. As we approach the elections, we just have to do exactly what we've been doing, even just before the celebrations, like even before the Eid, to tell people that they should not forget the fact that the virus is still around, and it is these political gatherings, these rallies, that tend to precipitate an increase in the number of cases. Exactly.
But I think beyond telling them, is there going to be any form of enforcement? Because I'm seeing that if we don't enforce, we might have issues. Is there going to be some form of enforcement? I mean, bring back, when it started, how Nigerians were scared. Everybody was, there was enforcement. Everybody was obeying the rules and all that, keeping to the protocols. Would they bring up another enforcement to say, people, you must do this? Because
many states, we're working with many states, and many states are actually enforcing the non-pharmaceutical interventions. There are teams that are monitoring how this is being observed, and clearly the closer we get to the elections, of course we'll have to work with INEC to ensure that all of these guidelines are followed. And in the past, we've worked with INEC to make sure that in all of the elections that were conducted, even during the pandemic, that all these guidelines were followed. So we're optimistic that even in those spaces that people will observe at least as much as possible the non-pharmaceutical interventions. In the end, people need to know that they are at risk. People need to know that even after taking the vaccines, they are still vulnerable. They still need to observe the non-pharmaceutical interventions.
Okay. In 10 seconds, is there any chance of a lockdown in Nigeria again? Do you think there's any chance? I mean, as a health worker, do you think there's any chance of a lockdown?
I do not think that that is likely to happen, because I believe that Nigerians have learned the lessons from last year that lockdowns don't help anybody. But if we're able to take our vaccines, if we're able to observe the non-pharmaceutical interventions, then we'll be able to flatten the COVID-19 curve.
Okay. We've been speaking with the Executive Director and CEO of the National Primary Healthcare Development Agency, and he has told us in clear terms that COVID-19 is real, and to flatten this curve, for us to have the herd immunity, like he's been saying, to stop, in order for us to now live freely without face masks and live normal life, we must all be vaccinated. Please get vaccinated and keep the protocols going. Sir, thank you so much for your time. We'll go on the break. When we come back, the deal will continue. Welcome back. I would take some of your messages. Like I said at the beginning, yesterday was awesome. Today, again, I like it when you actually join this conversation. I will take this message. It says, our government should meet doctors' demand so they will end their strike in the interest of Nigerians and come out and help to fight COVID-19 Delta variant. This is Chika Norom Umakabia from Abia State. Chika, I think the government is doing all in our powers, and they are talking with the resident doctors, and hopefully we would have a cause to rejoice, because like our guest said yesterday, it's an ill wind that blows nobody no good. So we keep praying that it is resolved. Okay, this one is from, he said, my advice on these two global diseases is that we should cooperate with the relevant health authorities by obeying all the prevention protocols from Akiola or Lola Day. Yes, Akiola, we should obey. That's the only way to stay alive. Now let's go over to Akwa Ibom State to see the level of compliance, the state of advocacy, and it's put together by NTA Uyo.
The evolution of the Delta variant is both unwelcome and surprising. It was first identified in India in December 2020. Within a matter of months, this particular virus has spread to over 98 countries. Are people aware of it?
Yes, there was a time when everything appeared to have calmed down, but recently there has been a surge again, which is why we have the issue of third wave of the COVID-19. So that is what and as you have rightly noted, this has been attributed to the Delta variant, which has been noted to be much more transmissible, more than 50% more transmissible than the earlier variant that we had.
All Delta variant monitoring mechanisms have been put in place to ensure strict compliance with guidelines and protocols to assist the states combat the new wave. Are people aware of the safety protocols?
It's our fervent belief that with the awareness programs that we are doing and all the advice being provided, that people would adhere to this advice, but where they don't, the monitoring team shall go around the state to be able to enforce compliance with this directive.
I've gotten my 2 doses of the AstraZeneca vaccine, but now you have the Delta variant of the COVID-19 virus that is killing people in different parts of the world. So we continue to encourage our people, let's protect ourselves. Let's stay alive. Most pandemics have a face. This face will go. So let's stay alive and survive this phase and live our normal lives.
We must keep social distance. Very important. We must avoid crowds. We must wash our hands regularly. We should wear our mask when necessary, where it is critically important, especially when you are in a crowded area, you must wear masks.
Meanwhile, all treatment centers and laboratories are fully functional and tests for Delta variant being done regularly.
I know about the screening center at Itungbang. It is working.
Now we have phototherapy machine, have radiant warmer, we have infant incubators. This will go a long way to improving my expertise in this place.
A new wave of the virus cases have been recorded to spread very fast since the advent of the Delta variant in Akwa Ibom State.
We had 17 before, but now if you check there, you see that it has gone up to 24. Even though the death rate for the state still remains at 0.8%, and that is purely also because the number of positive cases have increased. So the case fatality rate for the state still remains at 0.8.
Whether people believe it or not, Delta variant is real. Protect yourself and don't take it for granted.
We must continue to stay safe. We must adhere strictly to the COVID-19 non-pharmaceutical protocols. It will save our life. Okay, let's go over to Cross River State and see the level of compliance.
That was the hysteria at the inception of the deadly coronavirus. Matters arising from that included the second wave of the pandemic and now the emergence of a new mutation known as the Delta variant, said to be more transmissible, evident in the spike in COVID-19 cases in recent times. What then is the situation in Cross River State?
We are one of the states that the Delta variant have been discovered, and at least the case has been under control, and that's why we are really trying our best to inform our people and let them know, sensitize our people on this particular deadly variant.
Positive samples from Cross River State have been collected by NCDC to test in their laboratory to know if it's the Delta variant or not. We're yet to get an official communication, but we have heard from the PSC that there are strains of Delta variant in Cross River State.
But to what extent are the people aware of this Delta variant strain of COVID-19?
I'm aware of Delta variant, and as you can see, I'm putting on my face mask, which is a way of preventing it.
For us as a government, we've tried our best to ensure that people are sensitized. We've leveraged on media and also community engagement, community outreaches, town criers, and several other platforms just to reach out to our people.
What then is the situation in respect to the people observing the social distance protocol in the state?
In terms of social distancing, we know that because of it's a human factor, most times I think people forget about it, and you see people in different occasions going for different gatherings, and of course you end up, they don't actually observe social distancing, and for us we are really concerned.
It's sad that the fear for COVID-19 is gradually dwindling. Very many persons walk on the streets without their face masks. They go to public places, attend public events, political rallies, religious events, and of course even social events without protecting themselves.
How prepared is the state government to avert the Delta variant in the state?
We're working with the Presidential Steering Committee and the federal government as a whole to see how we can avert cases of the Delta variant in our state. We have 3 isolation centers, one in Ogoja, the General Hospital Ogoja. We established a new isolation center at the General Hospital Obubra because of the NYC camp, which is located in Obubra. That facility has been very, very active in recent times because of the cases that are coming from the NYC members who report to camp. We also have an isolation center in Calabar, which is at the University of Calabar Teaching Hospital, and we're presently working on another isolation center at the Lawrence Henshaw Memorial Hospital to accommodate more persons.
As the saying goes, a stitch in time saves 9. Our safety is in our hands, as it is our responsibility to play our part.
We're not asking for people to be afraid, but we want people to be conscious, COVID conscious, and carry out all the protocols.
And we're encouraging our people that you must take responsibility. Government can't do everything for you. At this moment, at this point, it's an individual thing. You just have to take responsibility.
Thank you so much for having stayed with us to the end of the show. From yesterday's show to today's show, I would say that let's continue. For our environment to take care of us, we must continue to take care of our environment. And again, we must continue to observe the COVID-19 protocols. We must keep safe. Until we come your way next weekend, goodbye. God bless you. God bless us, and God bless Nigeria.